When I got pregnant, at time of delivering, the baby failed to come out. So they just pushed the baby out by force. You know, in the bush, there's even no hospital. There's nowhere you can be operated. So it's like maybe it was all about because I was young. The baby failed to come out, and it's like because they've been pushing the baby out just by force. I got my bladder got burst, but I stayed for like 2 days without feeling any urine coming out. But then after 2 days, the urine I started leaking.
Nafuna utanga n'emyaka 17. Kati lwe nafuna utanga n'emyaka 17. Kale bwe twatuuka mu myezi 8 ne tutandika okubundula amazzi. Ne lumulwa amazzi ebbanga lya myezi 2 ne luyitako n'okuyitako. Ndowooza ne luli myezi 10 n'ekitundu. Kati ekiseera kyatuuka omwana ne bamutola bamuziika ne bajja ne bansaba obugoye ne bamuziika omwana.
Kati saasobola kugenda mu ddwaliro okuba lyali wala ne ngenda okumpi omusawo omuzaalisa Omuganda. Kati ekizibu kwe kyava bwe natuuka ne ntandika pushing sindika. Kati mu kusindika ennyo omwana we yali munene tasobola ndoza kuyitawo. Samanya kizibu nnyo kyali awo kusindika mwana kuba asooka ye namuzaala bulungi. Okufulumya omwana nga mufu afudde. Namalawo wiiki agenda okulaba nga butandika okutonya mpola mpola.
We operate patients of different age ranges. Like you found me operating somebody who is 78 years, who has lived with a fistula for 37 years. And this is an old lady from Tororo on the border with Kenya. And she says she initially had to seek for treatment, but she was told there was no cure, so she decided to go and remain at home as an outcast. She couldn't visit anybody, she couldn't go to church, so she's had a hard life. But recently she bought an FM radio and then she had it on announcements. And then she decided to come. She borrowed some money from the neighbor.
Fistula is a condition in which a lady following a very difficult labor and delivery, she suffers from a hole in her vagina, between the bladder and vagina, leaking urine all the time, and between the bladder and a rectum, which should be leaking stool. Not every case gets it. It gets the double fistula, but the commonest one is urine. And this happens in Uganda now very, very frequently. Many young girls and young women who are of small build, or who are not physically mature enough to have babies, as for instance with early marriage or with early rape in the early teens, when girls are only starting to in their procreative. Urine comes out and flows down her legs. She's always wet, and then her clothes are wet, smelly because there's urine on them. She tries to hide it. She's very uncomfortable and she gets very sore, but she cannot take part in any of the normal social activities, and she cannot mix around. She can't travel in the taxis or in the buses. So even her husband leaves her because of her smell and her condition. And very often she goes back to her mother, who has to build a little house lean-to for her so that she lives alone. These women are ostracized because of their condition, and they lose all their dignity. So it is a very big problem.
I could not even sit, because even just standing like this, the moment I stand, you find hole where I've stood wet. So I could not even stand, I could not go anywhere. I just keep seated. And I was like, what should I do really to get... I was not even feeling like living in this world anymore. I feel like I should just do anything to my life and just leave the world. Because the suffering, I've never suffered in my life. And secondly, they have ruined my future, and together with my studies, I was really not happy about it.
Nze yali yantama sijja kulimba. Newulira bubi nga ndi awo kwali kugamba nga ndi Katonda gwatafiirako ddala. Ngensinze nga ne wenda omuntu asanyuka ali awo azina ngamba yo bazina biki nga mpulira bubi ngensi yantama kwegamba nga nze simanyi ndiddamu n'okutambulako ne bannange ngaawo nembeerako mu bannange ngaawo netukuba olwali nga nze sikimanyi kale mu mutima gwange. Awo nabeera n'ekizibu nga sikola nga mbeera waka, wabula busente bwe nali ndesewo nga bwendyako mpola bwenkozesaako mpola bwentyo, naye nga nkolewa ku kizibu ekyo ekyali ekyamaanyi. Nga buli lwobeera olina okukyusa engoye, buli lwobeera olina okwoza, buli lwobeera oyambalamu katono, nga bwentambule nentuuka ngaawo wembasanze nga nkomawo nkyusa ngoye nteekayo ndala nga nyambala ndala. Sina mulimu gwenyinza kukola, nga tewalina mulimu gwenyinza kukola.
We here in Kitovu are trying to do something about this. We're training local doctors and training teams, nurses and anaesthetists, but the problem is ongoing. Every day there are new cases of fistula. Why is this? Because of the traditions and culture of going to traditional birth attendants, or not attending antenatal care, of not having proper care and proper nutrition during pregnancy. And as well as that, the women have no money of their own, so when they go into labour, they cannot go to the hospital or to a clinic, so they have no professional help to help them. So prevention is better, and prevention is cheaper than cure.
We have had to operate almost weekly. We operate every Wednesday and every Thursday, and we run a clinic every Friday. So the prevalence of or the number of cases, we don't know how many we have in the country, because these girls are hidden. They just come out whenever we put an announcement. But recently, when they carried out the demographic health survey, around 2.63% of women reported ever having symptoms of fistula. It definitely needs well-trained nurses to make them recover well, And these patients are special in the sense that they have lost their babies during delivery. In most cases, around 70% have lost their babies, and they are still remembering the circumstances surrounding the delivery.
On reproductive health situations in Pade, I would say there is improvement now if I compare with the situations in the past. We sensitize the community on, first of all, the importance of antenatal. We sensitize them on the danger of delivering with an unskilled person. We hope that with constant community dialogue, they can really improve and they will appreciate the importance of referral to the facilities.
The Ministry of Health has plans. One is to prevent new cases occurring, and this can be done through good antenatal care, family planning services, access to skilled birth attendants, and also access to cesarean sections and other interventions. The second aim is to operate on the cases which have already existed, and we are doing this by building the capacity of our national hospitals, by collaborating with the partners who come to operate with us, and also by giving information to the public so that they can access the services for obstetric fistula repair in the country.
When they did this operation and they brought me back home, after that I started feeling better, completely the way I want.
In fact, I'm really praying God because I always trust her. In fact, if we continue with her education, I'm sure she will bring at least a change in my family. And I'm now happy. I'm happy now. Yeah, only praying God for her. And I also want to send my congratulations to those who give assistance during our operation. Really thank those groups very much. Yeah.
Tufu singa saafuna buyambi obwo nandibadde sikyasomesa kati kuba nali nina obuzibu bw'amaanyi nnyo, abantu bonna bali bajja kitege ate nga nali kikuumye nga kyama kyange. Nasobolanga okugenda era n'omwami wange teyalina buzibu, yangumiikiriza kale mu kizibu ekyo nitubeera ffenna, naaba nga mpa bulungi obuyambi, tubeerawo nakati tuli ffenna.
Kintu kino kale twakibuulirako nze ne mukyala wange, yakimbuulira ne tukisirikira nze naye, era nga tewali n'omu akimanyi, nga ne maama waffe takimanyi. Ne ntandika kale kuba nti omukyala ng'oyo muba temwayawula bisenge, temwayawula buliri, nemba nga saamwewala. Oba gamba nti ngende ebbali ng'eyo ne tubeerawo. Nagumiikiriza okuba mukyala wange nali mwagala.
Nsobola ogusibira essaawa ebbiri oba essatu, naye luli ekitaasoboka nga wadde butikiti.
everyone has a role in terms of helping to prevent fistula and end fistula at the community level and at national level. The community play a very vital role in terms of their commitment to end maternal mortality and maternal morbidity. So it's very important for us in UNFPA to work with the Ministry of Health, with the regional hospitals, with the NGOs and the faith-based organizations to help bring up the capacity and accelerate the skills in the medical work, in the medical field, to be able to operate on many, many more women. So for UNFPA, the stories are really stories of hope. They are stories of people who gave them tender love and care during a time of immense need. And they are people, 3 young women, who have been restored and been reintegrated to the communities, as you will hear, or as you have already heard from their stories. Those are the stories that we want to get out, and those are the stories, the tragedies that we want to prevent in the future.
The Ministry of Health faces a number of challenges. One, we still continue to get new cases. So new cases are occurring and it gives a big challenge. Secondly, we don't have enough capacity, especially in terms of surgical skills, to do all the cases in the country. But we are getting around this by training people. Thirdly, we need equipment for those are specialized services, so we need special equipment to operate the cases. And until some time, this has been a problem, but I'm glad to say that now the UNFPA has assisted us to acquire some equipment which have given to the regional hospitals.
Nedda musawo nja kutuuka ekiseera nfumbirwe ndaba njagadde ndaba nteredde obulungi.
We are to find the gradient of the line which passes through the coordinate point 1,1.
Right now, as I speak, I am fully okay, and I can even cook. I can sit in the class. I can fetch water. I can do everything now, of which I could not do before.
Bwe nafuna okusooka nga nvudde mu kizibu ekyo nenzaalayo oli bebi noono naye nga nongoosebwa bulongoosebwa kati.
Kyempabula abala abasajja ng'abo abakyala baba bafunye obuzibu ng'obwo babe nga basobola okugumiikiriza, kubanga amalwaliro gye gali agasobola okuwonya ekirwadde ng'ekyo, bagumiikiriza okutuusa mukyala bwe basobola okuba nti awona.
Takunobere muhuma wange ndiegoromoro munyanja riru muhuma wange.
I'm now okay, and I'm dried and I'm fine. My life is back to normal and I'm back in school.
Ulikafunjwa kumnyanja muhuma wange niko basikise mikono yombi muhuma wange. Ngaya